All right, here we go. It's recording.
Well, there's only 2 people besides us, or do we count in participants? Oh, people are starting to join.
Yeah.
4 attendees so far. Five.
Yvonne's here. No, Yvonne is here as an attendee.
She's attending. Well, that's good news that she's attending.
I thought that she's not going to say anything.
Yeah, no, she's supposed to be a panelist. So
maybe she's both.
Beth, you've done this before, right? This hosting?
No.
Oh, you haven't? Okay.
No, we're in an error-likely situation.
So I'm assuming, so there's a Q&A box. I'm assuming people can all access it and just type in questions.
Ivonne says no camera.
Oh, she doesn't have camera. Okay.
All right. Well, if she doesn't join as a panelist, we won't be able to hear her either.
Right.
Ivonne says you need to upgrade her to a panelist. I'm just checking that out.
Okay, I just did that.
Oops. There she is, without a camera. Where are you? Do you have a voice there, Ivonne?
Your mute sign is on, Ivonne.
Hey, hello?
Yes, we can hear you.
We hear you.
One thing.
Can you see us,
but
Ivonne?
it doesn't work. You can't just do the webinar yourself. Let me just.
Can you see us, Ivonne?
Yes. I just see I'm a very suspicious person. Is a surprise ahead?
You're joking. It's the anniversary of the 40th anniversary of the Blues Brothers movie. I think maybe yesterday or something. So we thought we might be on a mission from God. Actually, I've always thought I was on a mission from God.
Maybe you are.
Okay, it should start now. But Sudeep,
Okay.
What about you run the webinar, the 3 of you, because I have problems with everything here.
Yeah, that's fine, Yvonne. I think we should be able to fill up the time, and we'll probably have more time for questions from the audience.
Yeah, can you throw me to an audience now so I can be from the audience?
Okay.
So, okay. Good luck. I'm looking forward. Maybe I can throw some questions.
Thanks.
What is happening?
All right, we should go.
All right, good morning, good afternoon, good evening, depending on wherever you are, whichever part of the world you're in. Welcome to the 5th webinar in the COVID-19 series being hosted by the Resilience Engineering Association. My name is Sudeep Hedge. I am a researcher at Texas A&M University, and my work has been in human factors and resilience engineering. And the speakers today are Professor Dave Woods, who is the former president of the Resilience Engineering Association and also the former president of the Human Factors and Ergonomic Society. I guess he doesn't need any further introduction. So we're also going to be hearing from him later today. We also have Elizabeth Lay. She goes by Beth, if that's okay, Beth. Elizabeth Lay is Director of performance and safety at Lewis Tree Services in Rochester, New York. And she has a lot of industry experience applying methods from safety science and particularly resilience engineering. So I'm going to start today's webinar with a summary of what we've seen in the series so far. And just as a context to that, we are in the midst of a pandemic. We are discussing a global disaster as it is unfolding. It's certainly not over. So, and hence the title that you see on your screen here. So, the speakers in the series have come from all parts of the world. We had our first webinar on March 30th, and then it's been roughly every 3 to 4 weeks since then. We've covered a wide range of topics, but all centered on resilience. There's community resilience, societal resilience, so some perspectives from the high reliability organization discipline and naturalistic decision making as well. But here we are. This is where the world stands right now. As of last night, the number of new cases is constantly increasing. And so the curve is still going up. Globally, there's no flattening as yet. Different countries have different rates of increase or decrease, depending on the measures that they've been taking. But that's just to iterate that we are right in the middle of a disaster or crisis. So some of the prominent themes that have come out of the talks so far from all the speakers that that were listed earlier. There is inevitable uncertainty. We are muddling through a situation that is novel to all of us. We don't know what safety precautions work or don't work or how effective they are. Of course, wearing masks is supposed to be the most effective, but what else? And is there a vaccine? So there's all kinds of uncertainty. The need for active learning. So given this uncertainty and given that information is arising every day and changing its shape and form, how do you keep that learning active? So that's been a constant theme, but it's important to keep learning actively and proactively and reconfiguring our model of what we know about COVID-19 and our response to it. There is certainly a need for community engagement, and there's different ways in which communities are getting engaged. But what is known is when there is solidarity and a sense of responsibility as against fear, you tend to see higher rates of compliance in terms of people's behaviors, preventive behaviors. And there's certainly a need for continuous information sharing and cooperation and coordination between various stakeholders. There's people in the community, at government levels, in various institutions and organizations, and across borders, geographical, organizational, and beyond. And a part of the way we can prepare for the crisis as it evolves is to continuously reconfigure our plans, procedures, and the physical layouts and facilities and so on. It's all part of anticipation, which is critical to being prepared and being ready to respond. There is also the need for innovation has also been talked about. People are coming up with all kinds of novel ways at various levels to prevent the spread of the disease, to treat people with the disease, to contain the infection and so on. So that's happening at various levels. We've also seen some lessons learned from China and Taiwan. Xu and Chang talked about how they were primed in Taiwan to this pandemic because of their previous experience with SARS. This is, of course, on a much bigger scale, but they learned to heed the early responses, the early signals rather, that were coming from the mainland. And they were very prompt and proactive with information sharing. and also strictly enforced various preventive measures, which were followed. And I think they've done a good job in Taiwan in terms of keeping the disease in check. We've also had insights from other lenses like HROs. Primarily, so Lauren Mooney talked about the importance of responding to weak signals, but there are very strong signals coming now in the pandemic. So the signals are everywhere, and the HRO principle is to respond early, respond aggressively, and make sense of all the information that's coming in and create foresight. The naturalistic decision-making speakers talked about the need to grow expertise. Now, this is a unique challenge because there is not a lot of expertise available. We are learning in the midst of this whole situation. So I think it was Gary Klein who talked about the need for dedicated learning teams to harvest expertise as it forms continually. And also to address the issue of information sharing and trust. We need to pay attention to who is disseminating the information, what level of trust they have, or what level of trust the population has in them, so that the information is taken seriously and heeded to. So that's a very, very quick summary of the themes that we've had so far. So I'm going to give the floor now to Dave Woods. I'm actually going to ask him a question. So, Dave, you opened this webinar series. You were the first speaker, and you've been observing how the pandemic has played out in different parts of the world. Now, how would you update your view of the pandemic response since your first papers came out 3 months ago?
Oh, thanks. Let's see. Oh, if you have to turn on screen sharing for me.
Oh. Okay, can you try now?
No, that didn't work.
I have enabled all panelists.
Well, I'll just start while you see if you can get it and cue me with a hand signal. So 3 months ago, I put out a couple of 10-point pieces. And I really want to comment about a couple of the things that came up and how I would modify those for now. The first one is the way that the rolling outbreaks of COVID-19 are a stress test of adaptive capacities at a global scale. And these outbreaks rolling across the world of a virus very well adapted to hijack and challenge all kinds of rifts at multiple levels, all the way from aspects of human physiology up to a continental and global scale of institutions and relationships. It impacts, obviously, the medical system, but not just in the normal emergency or critical care areas or specific physiological threats, but actually makes the entire system have to reconfigure in order to handle it with all kinds of side effects. It highlights the extensive and hidden interdependencies as PPE continues to be a shortage in some areas and a mechanism that hobbles many kinds of problems out there. It's revealed unappreciated sources of brittleness and systems across the board at all levels and all regions. Major societal asymmetries as certain groups pay the highest costs because of who were just service workers turned out to be essential, so that others could sit back and ride out some of the disruptions in a more comfortable way. The fragmentation across organizations and jurisdictions, even within countries and across countries, and particularly the time lag, since everything works at weekly, at a week kind of, it doesn't work, basis. So in some ways, the epidemic as a stress test is an example of this old Mike Tyson quote, which I think goes back other places, but everybody has a plan until they get punched in the mouth. And so I've been talking about, since that opening, a series of matched pairs of questions for everyone as they think about and extract lessons from this event as a stress test. Where is their brittleness in response to the outbreaks? Where is their resilience in response? And we see a mix of brittleness and resilience around the world and even within jurisdictions and different levels. And how does resilience come in to overcome brittleness? How do we amplify resilient performance? Or do we actually fragment and that so it can't grow and work at the scale necessary? The second pair is what roles are acting to support the front lines and what roles are acting to constrict and hobble the front lines. And of course, the big thing when we started was we were focusing on the medical response as the front lines. But it immediately became apparent many kinds of other services were the front lines as well. And they are bearing the brunt of the risk and often at the lowest level of societal rewards. What are we doing to beef that up? And you can see a lot about constriction and hobbling, certainly in certain jurisdictions in the Anglo-American world, versus ways that different levels and parts of society are supporting surprising kinds of front lines. As Sudeep referred to already, what's not surprising and what is surprising about the current situation? As always with surprises fundamental in our world, we get a mix of these kinds of things going on. And as I referred to with SARS or Zika and HIV and others, weren't there dress rehearsals for this? What happened to learning from these precursors and other signals? When we come back and say there was a basis for empowering more effective responses, it's kind of hard when we're in the middle. Why were these not turned into effective mechanisms over time? Well, if we look back at the 10-point pieces, I think there's a few things that are consistent, and Sudeep highlighted some of them. Keeping pace at scale given the risk of saturation. How do you build capacity to maneuver in these surprising novel situations with high uncertainty and newly appearing information available, but lots of noise going on as well. Keeping pace at scale, right, and avoiding the risk of saturation, that requires us to be able to generate and mobilize new kinds of deployable capabilities ahead of the bottlenecks. And we've demonstrated that. Shu Wen's studies of beyond surge mass casualty events highlights much of this, even though it happens at a different scale. I think one that I didn't call out explicitly in the original 10-point pieces is the need to hit windows for opportune action. Windows for opportune action. Pandemic response, infectious disease outbreak response is fundamentally about not just early, right, so anticipatory, but hitting the right window of opportunity. So timing matters a lot. Germany, as an example, missed some early windows, but was able to stand up an effective contact tracing very quickly and very thoroughly. And so the fact they were a little late on some interventions didn't matter much, or as much, relative to their ability to hit the window for contact tracing. So I think that's a nice example. Several of the points emphasize that coordination at new scales and in new ways starts to dominate. And that requires solidarity and reciprocity across roles. And that kind of reciprocity that we need it's hard to make it happen if the roots of this aren't there before the crisis hits. Building it during the crisis can be difficult. The roots for reciprocity and solidarity have to be there. The line I'm using is it if and when solidarity breaks down, it's hard to stop it spreading everywhere, which will undermine effective responses anywhere. Right off the bat in the stuff I laid out was the first thing about, some people are the source of resilient performance. Some roles will be under pressure in the novel, anomalous circumstances, and they will adapt. They will bring the capacity they have to adjust. Now, a lot of this is in the medical world, but as the event has gone on, and I think Beth's going to talk about this, a wide variety of organizations have had to, and roles within those organizations have had to demonstrate resilient performance as the reverberations and disruptions from the medical side and the medical health threats started to swamp all kinds of activities out there. The scale of the demand requires many parts of society and many levels of organizations and government to join in and become sources of resilient performance. And what's the point I made at the very beginning? And what is often, too often the case, they are not practiced at high tempo operations. They are not practiced at being part of responding to a dynamic, novel, uncertain, and changing situation. The part of what happens in this is a demonstration for many other kinds of crisis events that develop. The novelty of it leads to active pursuit to learn and to adjust normal practices. And that this happens outside of normal channels. It happens through new connections are built or repurposed, expanded in different ways. This is a very interesting, sometimes the IT technology provided avenues for this reconfiguration and re-enabling of old channels in new ways to build new kinds of collaboration and synchronization. And sometimes it gets in the way in all of this. But this active seeking and considering and building of new ways of interacting and coordinating usually happens kind of horizontally. It happens kind of down closer to the pressures on roles. And the more blunt end of organizations and systems needs to recognize those and support them. Normal vertical channels of communication don't work very well. They're too slow and too stale. And this has been demonstrated in many, many, many situations and is very vivid here. Sudeep made a strong point that the reconfigurations are continuing. There's a series of reconfigurations underway, and this applies to non-medical organizations responding who sometimes go, oh, whew, we kind of went through this reconfiguration to deal with this. Well, it's not over, and you're going to reconfigure again. The medical system is still engaging with its second reconfiguration after the initial one. And there are many signs of a third longer-term reconfiguration as many parts of, for example, in the US system, are finding their revenue streams disrupted as people, when and how people go for routine or semi-routine medical services has changed completely. But I want to make one key point that was in my original list that I ran through at the beginning. So this is over 3 months old, almost 3.5 months old. And I want to emphasize it. And I think the words I wrote then are exactly correct. The global scale of the COVID challenges have shocked the as-is system. The scale of the challenge reveals how, right? And these words are deliberate. The obsessive pursuit of optimality, a form of optimality, has undermined the sources of resilient performance, resulting in severely brittle societies. Delayed and ineffective responses to COVID, missing those windows for opportune action in parts of the world, have revealed the cumulative brittleness and how that's hobbled the ability of societies, nations, and jurisdictions to rise to meet the challenges. The inability to do that has increased the misery, mortality, and morbidity that has followed from this. It has put tremendous consequence on some portions, highly inequitable relative to other slices of society. The obsessive pursuit of optimality, right, has been revealed in terms of what it has done to reduce the capacity. And rather than talk about expertise, as Gary did, I would talk about it as competence. Competence has been destroyed by starving resources, And this plays out a little bit at local levels as they're starved of resources and enfeebled as they confront things. On the other hand, remember, they're under pressure. So they're the source of adaptive capacity and resilient performance to try to make things work. But you see in the UK and the US, the hobbling of federal institutions over time and their inability to step up, coordinate, and direct and expand the adaptive capacities and innovations that are happening at other levels of society. This is a pretty big lesson for everybody. This tendency to extract resources, right? We can run this more efficiently, take resources out, and deliver those to a tiny portion of stakeholders, continually enfeebling and undermining the ability of different kinds and parts of society to respond effectively to challenges. I think the biggest and the most stark, as I said, in the third paper we put out slightly after our original series, is places like the US get to do a redo. So, you know, almost 2 3/4 months ago, we said, the US will get a redo on the basic response to infectious disease that we all know is the best thing to do. And here we are almost 3 months after we said that, and the US still is barely able in a few jurisdictions to maybe get started with the redo of the fundamental steps that need to be taken to respond to an outbreak of infectious diseases. That is remarkable.
So you mentioned about the US, and the situation in the US is fragmented as the epidemic continues and different states continue to respond in different ways. So the US stands in contrast in some ways to other nations, or many other nations, that have been able to get new infections under control, at least partially. So you just released today an explanation of the contrasting responses to the pandemic in terms of 3 strategic bets. And I've just shared the link with all the attendees. You can go read his paper. So could you please describe your analysis and how it connects to resilience engineering? And do you want to share your screen, and are you able to?
I tried again, and for some reason it doesn't. It gives me. No, it's not going to work because for some reason it wants. It has something to do with security. For some reason, it's not. I don't know what's going on.
If you want to send it to me, and I can present for you.
Oh. Yeah, actually, it's by the time that gets set up, it's probably going to be easier to just talk through it.
Okay.
The things. I don't think this is that critical to watch along. They can listen more intently. So the new piece highlights, and this is very, for the moment, you know, think of this as US centered, but I think it speaks to some of the diversity of responses. And in part, the ability to talk about this in a place that has a mix of responses and as a large jurisdiction like the US is in part visible because of the contrast with places that have been more effective. So there's 3 bets that are circulating, and again, very visible in the US. One is the classic based on the past infectious disease responses, which is act early, act aggressively. So you're trying to hit the windows for opportune action with key steps to break transmission and provide time for the medical system and capacity for them to treat the seriously ill and develop better mechanisms for dealing with the disease and its manifestation and progression. This is based on a lot of things that have happened in past epidemics. In particular, we can look back at the 1918, 1919, and basically the bet here is, right, since I don't know what's really going to happen down the road, if I act early and aggressively to break transmission and to take care of the ill and vulnerable groups, I will reduce in the long run the harm to people, whether that harm is direct medical health effects, whether it's indirect health effects, or whether it's economic effects. In the long run, the bet is when all the scores are laid out, this will be the most effective way to contain the negative consequences, right? The least harmful, the least consequences and side effects of controlling an infectious disease outbreak come from this mechanism. Now, that is a bet because we don't know what will happen, right? The virus may mutate, effective treatments may arise, how immunity will develop are all uncertain in the future. The novelty of the disease becomes an important element in this as well. And it may turn out in the end, in the final analysis, after years of study and resources, that it wasn't quite as novel as it appeared when we were in the middle of things. The second bet is the density bet. And this also has some relevance to past studies of epidemics. In the 1918-1919 pandemic, the fatalities were heavily associated with dense events. Dense in time and space, areas where people congregate close together, depending on the segment of society that is most at risk from the particular disease mechanism. In 1918-19, we had this happening to young adults as a particularly vulnerable group. And so young men gathered mobilization for the US participation in World War I were centers where there was a great deal of disease and fatalities. After the war, celebratory parades were held in Philadelphia, but canceled in other places. And they led to widespread transmission and fatalities in those areas. So the density bet says, yeah, we should act early and aggressive relative to those areas of dense human interaction, dense interplay, but low density areas can pretty much go as normal. And you see that being said a lot in the US and lower population and smaller city areas, and other places far away from New York and Metro New York, where the epidemic was particularly awful, and say, that's great for New York, but I'm not New York. So I don't need to do any of these extreme reactions. The third one is the natural course bet. And that is basically that the pandemic will just have to run its course because there's so much uncertainty. And the actions that might impact on it are hard to figure out if they really have any effect. In fact, the ones that even look like they might be effective based on the partial emerging information might turn out to be due to other factors. The variation may be chance. It may be due to other subtle differences between different jurisdictions and places. It has nothing to do with these strong actions we're taking with lots of disruptive side effects. So in the end, the benign version of this is, well, yes, it's worth doing some extra stuff to blunt the worst consequences as the pandemic runs its course. Or, right, the variant of this that we see more of is the so what, quoting Bolancero, or Chris Christie in the United States, or the Lieutenant Governor of Texas. We just have to suffer the casualties, right? So what? This callousness in the face of risk to people is quite interesting. Now, these three are bets against the odds in our title, right? Because uncertainty, novelty, and noise combine to make the different options these bets allow you to do strategically and tactically to respond against the odds. We really don't know how it's going to work out. This fundamental uncertainty, right? That when you're in the middle of it, it will be more novel looking than when we can step back afterwards with lots of resources and figure out what really was new and what really was like what we understood and what really would have worked best. In particular, right now, we have a tremendous amount of noise. Places like the US are good examples of this, but Brazil and the UK as well are strong examples. And people are trying to hijack the debates and in order to serve purposes completely unrelated to the infectious disease outbreak and its disruptions. And then we have active disinformation campaigns going on that are trying to undermine the ability to build solidarity, cohesion, and a coordinated response. So how should we respond when we're in the middle of the unfolding crisis? right? Wait a minute, who studies that? Actually, we do, right? When you're in an unfolding crisis with high noise, novelty, and uncertainty, we study how you should behave. We study it with fireground commanders, right, Gary? We studied it with operators in power plant emergencies. We've studied it in emergency rooms, right? Intensive care, on and on. We have lots of data, and you could boil it all down to say, what do we do in the high uncertainty? Is we hedge our bets. And who knows the most about bet hedging at these scales? Just as an aside, in biology, organisms bet hedge, right? They do this. Guess who's one of the best at it? Viruses. Anyway, who knows about bet hedging at the larger scale of the pandemic's effects? Cognitive systems engineering, naturalistic decision making, right? Those have fed into advances in resilience engineering, where we're laying out adaptive capacities, overcoming brittleness, et cetera, right? Understanding more about it, understanding new techniques, and understanding more foundationally where these findings come from and what they represent. And I tried to summarize our findings. We might want to summarize them differently, but let's put one out there as hedge, but be decisive. Oh, wait a minute, how do we do that? Synchronize across roles and levels. But, right, in all three of those, you have to remain ready to revise as change, new information, right, the situation develops, evolves on various fronts. So those four things turn out to be critical in bet hedging. So let's go through them briefly. Just remind everybody, I think a fair number of the audience here will be actually up to speed on aspects of this and might want to help make this crisper, better in terms of advice moving forward. So hedging means while taking steps, you have to do them in a way that holds open or creates opportunities, increases the range of possibilities you can take, right? Your ability to change assessments, to change who and how you interact with different parties and coordinate with them, and of course, how you can change among different courses of action, right? So keeping open possibilities rather than closing them off. And that relates to some fundamentals that we've built up in resilience engineering about anticipate and readiness to respond. How do you anticipate crunches and bottlenecks ahead to reduce the risk of decompensation, right? How do you build a readiness to respond as new demands arise and interact? And again, we've seen that play out multiple times. So that's hedging. Decisiveness. Now that seems a paradox of the findings, right? But right, in emergency medicine, our friends would remind us to fail to act is to guarantee to fail, right? Being decisive. Our friends in aviation would talk about, right, the flight deck in an uncertain, rapid, not very big time window, need to be decisive in committing to a course of action, despite the uncertain partial information available. So decisiveness refers to the need to take partial uncertain information, given a background of past lessons and what usually kind of works, right? And make a commitment to a course of action, recruiting others to support that course of action, and following through effectively on that course of action, right? Think of Sully on the Hudson. You know, he might have made Teterboro. In fact, after the fact analysis says he could have made Teterboro, but he had a few seconds, right, to size up the other options and then follow through on his chosen course of action to make it work. Now, uncertainty about what factors matter and what tactics will work have to temper when and how to be decisive. Just blundering about and to do something, being strong but wrong, as the saying goes, is not following through on this in bet hedging. Now, there's a couple of constraints on decisiveness. And we've seen these play out in the work of Dave Deary, which we've talked about at REA meetings, looking at large organizations. And that's, how do you manage the side effects of taking action when there's extensive interdependencies? And that entails how you get highly tight coordination that is highly responsive with other units responsible for these interconnected systems, functions, and goals. And we've had studies in the past about how that works and how organizations can change in order to make that happen when they need to be decisive in a highly uncertain situation. Actions are moves in repositioning systems operation in a multidimensional trade space. So all of the resilience engineering work talks about multidimensional trade-offs, right? And so you're not just moving your operating point on a single trade dimension, right? You're not just valuing responsiveness or speed over thoroughness, right? You're actually achieving responsiveness and thoroughness in a totally new way, sacrificing efficiency and sacrificing normal processes, right? So we're valuing responsiveness over efficiency of resource utilization, and that requires moves that develop new forms of coordination, because standard and routine ways of operating and interacting are almost certain to be too slow and stale. And we see this very much in the beyond surge capacity events in emergency rooms and hospitals. And the third constraint is being decisive has to be tempered with understanding what goals to sacrifice and what goals to prioritize, something I talked about in the very first work when we started resilience engineering in the 2006 book. Actions require significant shifts in how goal conflicts are managed, and how goals need to be, where we're going to lean, which ones we can de-emphasize or relax, and which ones have to be prioritized. And as always, I love to use some of the NASA mishaps and space shuttle things to illustrate that. The third aspect of bet hedging is you have to synchronize across roles and levels. This is fundamental in the theory of graceful extensibility, but it's all through the different aspects of responding once you get beyond the scale of a small team responding to a crisis. No one role can handle all the reverberations as a situation deteriorates. Roles need to adapt to help each other. As another role, it becomes at risk of being overwhelmed by cascading effects. Meanwhile, constructive actions by any single unit, I'm almost done, need to be supported and amplified by synchronized responses across other roles. And this heavily depends on how we coordinate multiple centers of authority and how we build reciprocity. And so last is, right, hedges depend on the ability to be ready to revise, because we can revise assessments, relationships, courses of actions, models, goals, priorities, right? Because we don't want to get stuck when evidence changes and the situation changes and we need to continue to adapt. We need to be poised to adapt. So where are we? Where are we now? We're gambling against the odds. Most of the people out there are making a bet to win. It's like rolling the roulette wheel and saying, I'm going to bet it's going to be 52 black. And you're like, that's not really not great odds. Oh no, when it's all over, it's going to be 52 black. You're like, maybe that's not the best way to bet. Right? What do we do and how we understand responses to uncertainty is focus on what's a good process before outcome is known. Now, our bets, though, are not by ourselves. Right? The bets are pooled. So your bet depends on the bets of others around you at different levels of society. And it's very easy for for people to defect and fragment. And so all cohesiveness is lost. We are hedging bets under tremendous uncertainty, noise, and novelty. The story is far from over and still to be written. We still have choices about our bets and how we pool and coordinate our bets. And the question I'm left with is, will we be proud of our bets when the final human toll is counted?
Right. Thank you, Dave. So before we move on to Beth, a couple of people have noted in the chat that the link is not active, so I'm going to work on fixing it and sharing it with you again. But I'll hand it over to Beth now to talk about some perspectives from business and industry.
Thanks. So I have an idea, if you guys are up for it. And the idea, so don't hit your mute button, Sudeep. My idea is that I'd like to share the story of how we've dealt with the virus at Lewis Tree in pieces and then get your thoughts, because I think this is a great opportunity to get your input on some things that we've done and how we might have been more resilient. So if you guys are game, I'll start to tell the story and then I'll pause and get your thoughts and input.
Okay, sounds
Go
good.
ahead.
Okay, so I work for a company called Lewis Tree, and Lewis Tree Services, we clear trees and we actually fell whole trees and clear branches away from power lines. And so Dave said something that was really interesting. It triggered me. He said, we need to be practiced at responding to high tempo challenging situations. And it hit me when he said that we have been, because so another thing that we do is when we have a big storm, like we have hurricanes in Florida or whatever, part of what we do is we respond to storm, and we actually drop crews in when right as the storm is barely leaving that area to go in and start to remove trees off the down power lines so people can get power back. And so we call that, when we move into that mode of response, we call it moving into storm response. And when we move into storm response, it's this super heightened state of coordination where a group of leaders call in at the same time every day, and we talk about what's happening in each situation, and we kind of problem solve together. And so when the virus hit, we moved into storm response. And we started out with a fairly small group of executives that were part of that storm response or crisis response mode. And then we gradually broadened it a little bit. But so we started this heightened state of awareness where we would have a daily call, even on weekends. But the question is, what do we do in that daily call, right? When you have a storm, it's kind of obvious because you're dealing with a variety of situations of, where the crews are and the different challenges they're dealing with. But in these calls, I think some things are obvious, like we monitored. So some of the things that we monitored on those daily calls were, what does the front line need? And there was especially a lot of monitoring going on at the beginning, like simple things. They need masks. They need materials to clean the trucks because they're driving in bucket trucks. We also talked about the number and location of confirmed, self-quarantine, and no-call, no-show cases. So this became a report out. We didn't have a whole lot of cases, so we still haven't had a whole lot of cases, which is we're very thankful for. We also talked about customers. What are our customers who are utilities? What are they doing? How are they responding? What do they expect from us? Because, with utilities across the United States, as you can imagine, they're handling it in different ways. Some require masks all the time. And so we're also trying to navigate these changing and varying customer requirements. And the thing that I think that that as a resilience engineer that I brought, and I kept trying to think, okay, what do we need to do to increase resilience? So as I'm hearing these report outs, for example, it almost became a little bit routine, like going down this list. Region 1, we had one confirmed case, we had 5 no-call, no-shows, et cetera. It became like this report out, but I felt like we were missing opportunities for resilience. And so I started trying to craft questions like, well, when human resources is reporting out, I might say, well, did you have any surprising cases? Or, let's step back and look at the big picture. What's the rate of change? So I was trying to bring in resilience to those daily calls the best I could. What are y'all's thoughts? Like, what else would you have looked at on a daily call like that?
Well, I think I think the first thing is you're illustrating how, because you have to respond to a variety of kinds of challenge events, from storms, especially as extreme weather events increase in frequency and scope, right? You are, in fact, have a practice set of ways to deal with things in order to build on in terms of bringing in the novel aspects and interdependencies that the disease outbreak introduces. The second thing you highlighted is that you already have a mechanism for coordination to build on. You have to integrate and connect a variety of parties and issues at different levels in order to handle, you know, the variability and challenges of storm-related damage. You, in the storm response, you do have pressure and some degree of relaxation. You want to get things restored quickly, so clearing trees and debris matters. On the other hand, you can step back and slow down because of the risk of harm to the workers. When electric wires and other kinds of hazards are present, you can back off and step away and say, well, we just can't get to that yet. Or we can wait and say, I need, while other resources are assembled in order to tackle that. So you have a great base from which to build. I think what happens in this case that's different, and I think you start to see aspects of that in the details of the calls you're talking about, is the fact we get these kinds of special kinds of interdependencies called strange loops, where the constraint that you need to deal with also constrains your ability to respond. And so your workers are now, you know, in the regular thing, your workers aren't subject to the falling trees, they're coming in to clear them. And you can step back when there's a hazard in doing that. Now everyone's exposed to the virus and can get sick. And worse, you're putting the people out in the world where they're separated from their resource base. How do you provide for them if they get ill, if they get the virus and get ill from it? And you can have a mini hotspot where you wipe out your entire team for responding to events that occur. As the extreme weather season through the summer builds up in the US, you now have, whether these are small tornadoes like some wind damage went through Ohio a few days ago, or whether these are bigger kinds of storms as hurricane season. We've already had some tropical storms hit. This interaction of, you could have a hotspot that wipes out the ability of your crews to respond effectively. And now where do you bring your normal mechanisms for bringing resources from one part of the country to another? Because extreme weather events and challenges tend to they may be big, but they are over here or over there and not someplace else. Now it's everywhere potentially. Now, because you are waiting for the rhythm of your season to build, you do have some time in many of your areas of operation to introduce rehearsals to plan out the new steps and build on things, right? And you know, that's, I think, one of the things I would be thinking about, which is, and of course it has this it fits this old saying, which I think is in the first resilience book of, right, the energy required to build safety is most needed when least affordable.
Ah, yes, yes. And it's funny that you say that, Dave, because, you know, pretty early on, it was obvious that here's an opportunity, right? Here's an opportunity to bring in some thinking about brittleness and resilience. And so I brought it up to my boss, who's our CEO. And he's like, it sounds like good stuff, but, you know, we can't, whoa. So I was thinking about that earlier, because I was thinking, right when we most need resilience, right when we most need this thinking is the time when people have no extra capacity to work it. So I had to figure out, how do we work it? Like, how do I help and support this organization to be more resilient, or to do that without going, okay, here's resilience engineering, here's what we would do, because we didn't have time for that. So the best I could do was try to craft questions to ask in meetings to lead us that way, and to, you know, maybe to provide a little bit of coaching here and there on, you know, things like opening options. But I also offered to do a risk assessment, and that was accepted. And and through that risk assessment, I was actually able to probe brittleness, and we were able to design for resilience in some ways as part of that.
For multiple decades, I've said, despite the way people attribute cause to accidents, and and that always becomes very narrow and sharp end oriented, or very vague and vacuous. That the pattern that I've seen for essentially 40 years is missing side effects. And this is because we started out dealing with a complex system with the emergencies and failures in nuclear power. And so side effects of action, side effects of changing plans, side effects from a new threat emerging in a highly interconnected, interdependent world. And very evident in Colombia as an example. And side effects, missing side effects becomes a very major aspect, as I indicated in what we understand about being decisive, but constraining that with setting up mechanisms to look for emerging side effects that you don't like and try to manage them. An example at a national scale would be treating the economic consequences of your early aggressive actions as disaster relief. So that a variety of countries have had much smaller economic downturns than the UK or the US, for example, because they tailored a response to a side effect of the direct disruption as well as the indirect disruptions from modifying and reconfiguring healthcare in order to reduce the impact and therefore speed the recovery as the things stabilize from a disease point of view. So that would be a fairly global example of this. In your world, it would be very specific things and saying, how do we set up the interactions and information exchange in order to be able to do that? I think one of the great examples of opportunity and positive response has been the medical world engaging relatively quickly a very wide variety of channels in new ways to new purposes to share information rapidly. Now, the downside of that is it's partial, uncertain information. And we can't wait for it to become more definitive. And so you have all these roles trying to balance, is it this or that? I mean, we can get into arguments between Gattoni, one of the big respiratory specialists from Italy involved in their response, and his view of the disease mechanisms and progression. And people from New York and Seattle going, that's not quite what we see. And you see these arguments. And that's not bad, that's necessary. Right? That you have set up the channels in which you can debate and try to understand. Now, Lancet blowing it on this other study is an extreme one that they should have been much more careful. It's a great example of the misbalancing responsiveness and thoroughness.
Wait, don't go there yet. Don't go there yet, because I want to build on what you just said, because I think this is important. So we actually did do a risk assessment on what would it be like during storm response. So storm response, typically, you've got people bunked out in really close quarters in these portable trailers. You have everybody eating together in a big tent, and the utilities supply the food. Your technology limited, right? Your power's down. You may have cell towers down. So, you're in this situation where people coming together and communicating in large crowds is how communication happens, right? Because you're missing all these other tools to communicate. And so that was actually one of the major concerns with the risk assessment is what happens now when you're trying to avoid that, right? What happens now when we were relying on communicating by bringing people together and talking through and talking about the work for the day, et cetera, et cetera. Now what? So I think that is one of the secondary risks. Still yet to play out because storm season's just beginning, right?
Well, I think your risk analysis was just the right kind of lever, because with that, you were able to do preliminary looks, able to look at interactions. You were able to do little walkthroughs and rehearsals with people. Okay, if this happens, how are we going to deal with it? What are the constraints or the guidelines for disease transmission control mean we do X? Wait a minute, we do the opposite of that.
Yeah, exactly. And if you do X, it brings in all these other secondary risks. So we're, I think, almost at time, right, Sudeep? I mean, we could go on. I'd love to talk to you for another.
Well, we started a few minutes late if we want to keep going. Just keep going.
Well, I have a question, Beth, and very related to what you've been discussing. What kinds of learning mechanisms do you have in place to, because you cannot avoid responding while you're learning something in a new situation. You have to muddle through it. But is there a way that you're documenting these things that we're talking about that can come in handy as you build coordination and adaptive capacity?
Well, probably one of our most important learning mechanisms has been we do after action reviews all the time. And one of the questions that we use that is a little bit unusual is what surprised you? So that's one of our key learning mechanisms is after action reviews. But I mean, so part of what we're talking about hasn't happened yet. I'm sure that we will do a lot of after action reviews to document how it goes as soon as storm season picks up.
So, but my advice to non-medical organizations right now is who have drawn on various capacities or having to have been aligned with the opportunities to help people cope, for example, in the digital infrastructure world. And this sense of, hey, we reconfigured. This is great. And I keep looking at them and going, this isn't over. You're going to be asked to reconfigure it again and again. This is don't rest on, we got through that. One of the great mistakes was the initial curve where the onset was appropriate of like, we've got to reduce the slope in order to not overwhelm healthcare systems. But they threw in a completely unnecessary set of assumptions about what happens next. The answer is it keeps going. It doesn't just decline. It doesn't go back to normal. There is no new normal, a normal constrained by the fact we just had a big disruption and we have to deal with the residual challenges, the cleanup after the hurricane of getting all the debris and moldy stuff out of the way and off to a dump somewhere. This is producing fundamental change and opportunities. And one of the reasons we started resilience engineering was to not just focus on coping effectively, but on seizing opportunities. And the stories on opportunities have barely begun. I think the stories have actually, in the real world, are happening already. But our ability to understand and see these stories and to track these stories and to consciously reflect and steer these stories has barely happened. I think we see some of the jurisdictions that are floundering are at risk of also floundering in the search and ability to take advantage of opportunities because of that fundamental dysfunction and lack of competence that's been degraded over time by this obsessive pursuit of this narrow sense of optimality for just a few people. And that's just technically going to make a system, crumble when it gets pushed too hard.
So Dave, early on,
but I think we have to emphasize for the organizations that have done well that this isn't over. And the important thing isn't just that the pandemic isn't over, it's you've barely begun to take advantage of the opportunities that are presented, to rethink, redesign, reconfigure different aspects. And don't lose sight of that because you did well so far, or you think you did pretty well, right? Big opportunities, what are they? Dig them up, pursue them, try to build cohesiveness in terms of and participation in where and how you want to do this, take advantage of these changes.
That's food for thought, because I think that it has created opportunities. I mean, some of them are obvious for us as well as for other businesses. And one is that we, everybody began to work from home. So we built that capability, right? We now have that flexibility in our system where everybody is able to work from home if we need to do that. So that's kind of an obvious advantage or new strength that probably a lot of companies are experiencing. But I think there's more. And you've opened up my thinking on that, because I think as we've gone through this process, okay, here's another example, but I don't know exactly how we leverage it or what it means yet, is as it was like, especially in the beginning, it was really hard to get supplies. And so our local frontline leaders, our general foremen and our safety specialists, they became very resourceful in looking everywhere to get cleaning supplies or masks. And so that ad hoc support of local leaders, I think, is a real strength of ours. I mean, for sure, right?
Absolutely. I mean, why did Kerala stand up an effective contact tracing, a poor state in India, right? Because of what you just said. They had empowered local, in this case, healthcare and educational centers, and they had initiative, and they were a network that had communication lines and relationships. So this wasn't about money. This wasn't about 21st century medical technology. This was about not having undermined and starved, the local institutions, and having an effective relationship between the state or federal level and the local institutions, right? Things that have been degraded for a long time on multiple fronts, on multiple vectors, just trying to keep eating away at that capability in some areas like here. It should be a giant warning sign to people, despite the noise and the hijacking and disinformation going on. So the bigger question is, Sudeep, go ahead, please.
Sorry, there's a question in the Q&A. So Ivonne asks, Beth, what about learning when things go well? Focusing on the crisis situation might miss something, or do you look at the crisis situation to investigate both what went well and what needs change?
That's kind of an interesting question, because learning from what goes well is part of what we do. Like it's part of our daily conversations. In fact, we on Tuesday mornings we have a call where we review close calls, and in many cases there are close calls where things went well. Right, where we had a good catch, and due to great leadership and actions of our workers, things went well. I don't know that we've applied that as well to the COVID situation. It almost feels a bit more, and I'm going to say this. It's going to sound bad, but Dave, you said it, and it's not bad. You started out by saying muddling through, right? And it's kind of felt that way to me, like it's felt like we're muddling through, and we are, but I mean that in a very good way. And I think the way we've been able to muddle through successfully is a super high level of leadership engagement. And one example of that would be, I was really struggling early on with uncertainty. Like, what do you do with the cases? What do you do with these calls where a person says, I've got one symptom or I've got two symptoms, where there's a whole lot of uncertainty about whether or not they have the virus? And in one case, we had a safety specialist who thought he might have it. He couldn't get a thermometer because there weren't thermometers to be had in the area where he was, which is densely populated, and it was a hot spot at that time. So I think that I'm going to say, I guess it turned out to be a good practice, is we made very conservative decisions, like super conservative decisions. If in this case, we told the safety specialist, stand down. We don't want you out visiting crews because you could be a super spreader. So we had them, even though we were not certain if he had the virus, we said stand down. But the other thing that happened is in our human resources group, the level of leadership engagement in working through each of these cases was extremely high. I originally thought we should come up with some kind of a decision tree to help us deal with the uncertainty around cases, but it ended up that leadership engagement was the answer for us in figuring out what to do in those times of high uncertainty.
We've that question has come up. And this is the credit assignment kind of and reaching closure problem. Mm-hmm. So think of computer companies who were challenged to step up because everyone was more reliant on their services. And so the services became more critical in more places at the same time under more load. And so they have to adapt in order to support everybody else.
Right. And can I add to that, Dave? That became the same for us. Like if we cause an outage, it became even more critical, right? If we accidentally cut, or if we cut a limb and hits a line because it's a windy day and we cause an outage, then we cut that's the internet for everybody. So we were feeling that same pressure, and we actually had to change how we manage that risk.
So this, one example of these computer companies, talking to them, and they're like, hey, this is great. Look at how we adapted and we utilized this technology and that technology to rapidly scale up. And we transformed in order, because we had to work at a bigger scale because of problems. So we used more virtual technology in order to increase the throughput of our helplines. Everything was going great. Look at our technology supported all this stuff. And I'm like, yeah, but that's not the level at which the positive lessons exist. That's great. In this one, it turned out that some technologies you had and been developing were called into action. Mm-hmm. Those were just resources. They were just resources. The issue is, how did they get called into action? How did you understand what you needed? How did you check that this really worked? These are more distributed, they're more human, they're more interactional, they're more cross-organizational lines. There's all kinds of processes there. You said it in the way leadership was coupled. If leadership isn't coupled in the right way, look at the US right now. When leadership isn't coupled horizontal, right? The people under pressure will adapt. They will try to inject resilient performance to their degree possible. But because of that missing layer of coordination and amplification, what they do doesn't connect and become a bigger, more successful, or become something that they can't sustain for too long. I mean, we still haven't gotten to the epidemic of stress on healthcare workers. Right? They continue. I mean, it's amazing how long in the hard-hit areas, even though things have tailed off, the level of extra stress in the critical care areas is still, compared to a normal time, would be very high, even though they're nowhere near the peak stress they were under. And they haven't been able to take a break. Xu Wen's study of a bad beyond surge capacity mass casualty event, it was awful for 7 hours. But then they still recover. These people have been doing it for 3 months with hardly a chance to do any recovery.
Sorry to interrupt this fascinating conversation, but I have to leave now. So we are 10 minutes over. So Dave's paper is available on ResearchGate. I just shared the link, and also on Zenodo, for those of you who are on Zenodo. Okay, we have one more webinar in the series on June 29th, and that's going to be very interesting as well. So all the attendees here, please tune in, and we will revise the link to the papers on the website as well to make it available. So thank you, Dave. Thank you, Beth. This was great.
Thank you.
That was fun, Beth.
It was. I know. I enjoyed it.
All right. Bye, everybody.
Bye. Take care.